Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to introduce Dr. Rhian Davies, who is the Director of Complex Coronary Interventions at the WellSpan York Hospital. Rhian, thanks again for joining us today.
Thank you so much for this opportunity. I'm very excited and honored.
No, thank you. And I know that you have been a very high-level operator for many years, but how did that start for you? I always ask people, what was the incentive? How did you get motivated to become a complex coronary operator? Did you know you were going to do that? Did something happen during your training afterwards? What was your journey to becoming an expert interventionalist in complex PCI?
Well, I think my first real experiences in the cath lab started shortly after starting general cardiology fellowship. I was at Penn State Hershey Medical Center, where I trained with Dr. Ian Gilchrist, and he really encouraged me to pursue a career in interventional. And I think in the early days, just seeing the straightforward STEMIs and end-STEMIs come in and giving them relief and making them just such an improvement with their symptoms, it was really satisfying. But then going and getting my interventional training up at Brown with Dr. Abbott, she took on a lot of complex coronary cases. And from her, I really started to have that little bit of excitement. The more challenging the case, the more gratifying and the more appreciative I felt that the patient was and I was of doing the work. And she really encouraged me to pursue CTO PCI because she felt that that was kind of where I was falling into favor. And I was fortunate that I got to go out to University of Washington and train with Dr. Bill Lombardi, Kate Kearney, and James McCabe, and really fine-tune that CTO PCI aspect of interventional training, and was blown away through the course of the year with all the cases I was able to do and be a part of.
Wonderful. So you clearly got exposed to some of the best operators in the country and the world. But those cases can be challenging, right? They can be difficult. They can take a long time. They just got complications. Did that ever bother you, or that was part of the allure of becoming part of that?
Yeah, for sure. I think, it's wonderful when cases go well. It's that much better when it's a really challenging case and it goes well and the patient feels great. But those cases that don't go as planned and you have a complication, I feel you learn a lot from those. They're very humbling, and you just have to figure out a way to deal with those. I guess in the back of your mind, you have to remember that you've helped a lot of patients along the way. But they definitely stick with you. I've had now coming out into real life practice on my own, a few of those along the way, and they're one of those you really need to do. You need to know that you're doing the right thing for the right reason and you're working on the right patient, and being honest and upfront about the risks of complications is a true necessity doing these sorts of cases.
And what was the thing that you found most difficult to learn? Was it the technical part, the mental part? What were the things that you found the most challenging?
Oh, for sure, the technical part. When I started, every case is different. Every reverse cart is different. Every ADR is different. There's no two cases that are the same. Some you fly through the first couple steps and then the back end of the case is challenging. Other ones, like you have a lot of challenge up front and then it's smooth sailing to get the stent in there. So definitely the technical. The emotional part is what really hit me towards the end of my dedicated year of training, and then coming out in real life and having the courage to kind of step back up to the plate and do it again after I had a case not go so well. So it was definitely learning, but also handling the emotional aspect of those kind of cases, I think is now probably the hardest and will continue to be the hardest part of the job.
And what is your approach? Does it take you a while to bounce back? Do you get depressed? Do you talk to people? How do you handle when things either fail or if a complication happens?
So I think at first I kind of seclude myself, and I get scared because I don't want to fail like a failure, but I think it's really important to talk about it because I found that if I don't talk about it, it makes me more scared to go back in and do these sorts of procedures. I talk to Bill a lot. I talk to Kate a lot when I have those cases not go so well. And it's not, I don't want somebody to be like, oh, no, you're okay. You did the right things. I need to express how it went, where I thought I went wrong. I need to like kind of work through it, process it, and then move from there and learn from those situations so I don't repeat it. If it was something from a technical error versus post-procedurally, something, otherwise that went on. But I think talking about it is super important. Outside of that, I think doing activities that are therapeutic for you, whatever it is that you enjoy, is super helpful. I enjoy running. I run long distance at times, and I think sometimes that's very clearing for my mind. I ride my horses. I try to escape and do something unrelated to work sometimes, and maybe that's for a day or so, and then I kind of come back to it. So it's case dependent, I guess.
Perfect. Well, we clearly have found a great way to, get this to work and you keep your positive attitude and the motivation to keep on going. But are there any times that were specifically important for you? Some cases or some good cases or bad cases that really stuck with you that you think you've learned a lot from during any stage of training or when you've been in practice?
Yeah, that's a great question. So I think one of my first CTOs that I did on my own as a solo operator at my new institution, it was like a retrograde RCA. It's probably one of those slam dunk bread and butter CTOs that you can do. But to me, it was so gratifying. The patient, when I went to see him post-operatively, was like so thankful, and he immediately felt better. It was one of those cases that was just super satisfying. And I was like, wow, I think I'm really doing the right thing. And shortly thereafter, I did a complex case. It wasn't a CTO. It was maybe 3 or 4 weeks later. Everything went really well during the procedure. I fixed 3 vessels. They were all like heavily calcified, did some roto, did some additional cleaning up of the vessels, and the procedure I felt was fine. And then he went into the post-procedure unit, was okay, and then had a massive stroke. And I think that was eye-opening to me, because to me, the case was challenging, but it was not a CTO. It was not something that I was anticipating as a complication from it, but there is a real risk for stroke with what we do. And I think it was one of those situations that very eye-opening and really made me thankful that I had talked to the family ahead of time about the risks and the benefits of the procedure. But it's something that just sticks with you, because sometimes the case may seem super complicated or super challenging and then go super well. And then other ones where you're kind of like, oh, this is okay. This is kind of bread and butter interventional these days. There's not really a lot of type A lesions out there, and then you have something post-procedurally that happens that you just are like, wow, really taken back by it.
Sure. So I guess you never know which case is going to be the tough one or not.
Yeah.
How have you found the staff and the environment? And I know you've been, obviously in great labs in New York with, Bill Nicholson before. Clearly has created a great culture. How has that been for you? And is it helpful to your success? And also, do you spend time to teach the staff members to help with procedures?
Yeah, so I think I really learned a lot from being with Bill Lombardi out at UW and seeing that what he calls horizontal communication, where the staff has to have the opportunity to speak up if they're uncomfortable about something or they're questioning something about a case. I enjoy that. I think it's better that we have an interaction and that they're following the case closely and they know what's going on, and making sure that, if I'm doing a technique that they haven't done before, that or seen before, that they're understanding of what the next steps are going to be. So they're kind of waiting and ready to go with whatever equipment I may need. So teaching, proper prepping of the devices that we're using. Additionally, having them just feeling comfortable as the cases unfold. A lot of labs right now have travelers. We have travelers. We have people that haven't seen these sort of complex cases being done before. So it definitely makes it a little bit more challenging for the operator. So you be in open communication with everybody so that they're aware of what you're doing and that what you're doing is the right thing and you're trying to help, and this is going to be the next step, and we're going to balloon, now we're going to need a microcatheter, now we're going to IVUS and do our stenting, just so they're kind of aware of the next step, so that they're understanding of what's kind of going on and not just jumping around and not explaining what you're doing. And then I think that makes it very unsettling for the staff. So I think making sure that they're all understanding and moving along in the case the way that you're moving along in your head with the case is super important, particularly right now with all the travelers and the new graduates coming out. COVID really changed, I think, the dynamic in the cath lab, and I think a lot of us are trying to figure out what this new change is going to be like down the road, but and hopefully regain some stability in our cath labs with the staff.
Yeah, absolutely. And we have the same situation, a lot of travelers. Some of them have been actually excellent. Some have been less experienced and complex, but you're absolutely right. Being flexible is important. Now, when it comes to teaching, and I know you've interacted with many people, taught many people, are there some attributes, some characteristics that you find important for the person who wants to come and learn? Is there something that makes you excited to teach the person?
So I think, that's dependent on maybe the level that they're at, where they're at in their training, and what excites them. I love challenging cases. It's what drives me every day to get up and go to work. I get excited about doing them. I get excited when I'm mapping out my cases the days and the weeks prior to the cases. And I try to figure out when a fellow or an attending or a doc that's been out practicing for a while is coming, kind of where their level is and where they're trying to get to. And I think the biggest part of it is doing it in pieces. You can't learn everything in one case, but if you want to learn retrograde, getting comfortable with retrograde in the sense of which microcatheters are better in which situations, which wires are better in which situation, like trying to teach along that side. Alternatively, if they haven't done a lot of ADR, being comfortable with Mongo or Stingray and getting facile with how to make your knuckles, your bends, that sort of thing. Or just more standard stuff like having 2 access sites in. What are the better access sites to have in a particular case? Like if they're post-bypass and you're trying to figure out anatomy, maybe going femorally. But if a patient has back pain, maybe trying different radial, bilateral radial techniques, that sort of thing. It kind of, I guess, depends on the level of experience that the person is coming with and then what they're trying to obtain, and just making sure that you're not giving them too much at once, because that can be very overwhelming and also a little bit intimidating, but just trying to piecemeal it so that they leave the lab in a better place than they came in, and they learn something in that day that they can take forward to their institution and maybe start to do sort of more of the complicated cases there.
And how important is the skill, the manual skill and the dexterity? Is that a key parameter, or you think that can be learned?
That's a fascinating question. I think that is something that can certainly be learned. I think having patience is important, though, and I think sometimes that is a challenging part. People just want to get good at it really quick right now. I want to do 5 retrograde cases, and then I want to go out there and I want to do those retrograde cases. Well, it might take more than 5 cases, or maybe you're just a natural and you're just going to fly through those septals or fly through those post-bypass occluded grafts and just get it done. But I think, just having patience both with yourself and obtaining that skill is important. But yeah, I think it's hard sometimes learning something new if you're not patient with yourself, and as well as the teacher being patient with you. But I think from a skill standpoint, or the technical aspect of it, I think you can learn if you give yourself the opportunity to learn it.
And then obviously you reached a very high level of maturity and expertise. Do you think there comes a time where things are just, you've kind of done it all and seen it more, you still feeling you're learning and finding new ways to do things? How do you get a sense of things going at this
Yes.
point?
I think every time I do a case, I learn something new. It may be something very small. It may be something of, the position of a catheter, the way that it just made the wiring that much easier, or just something subtle. It can be something really big. Like sometimes, when you're setting up for a reverse cart and you're not making the connection, you just have to use a 3.5 balloon or a 4.0 balloon. You just got to be braver than what you were previously. I think, every case, though, I learn something from. I really try after cases to reflect on them with the staff and just say something like, "Oh wow, that was great. This is cool." Like, and make sure everybody in the room kind of understands what my excitement is, or me nerding out about something that I got excited about. But yeah, so I think if you're not learning, it kind of gets boring. So I feel like you have to find something that excites you. And to me, being a dedicated CTO operator, I want to continue learning. I want to get better. I want to be better for my patients. So I think if I'm learning something from every case, it's only going to make it better for me in the long run. So.
And Rhian, how do you prepare for cases? And has this changed from before to now?
So that I think films are certainly important. Unfortunately, not all films, if you're getting them from referring providers, will provide all the information that you would have done if you were doing the diagnostic. If you have films from before they had bypassed, then they had a couple stents placed, or then they had a couple grafts go down, and you kind of have the road that they traveled, in regards to their coronary disease, and that how the anatomy is somewhat changed, I think is super helpful when trying to plan these cases. But I really try to sit down. I try to sit down days before, usually, when I meet them in clinic, and really think of like game plans, look at collaterals, sort that out. It doesn't mean that I would turn a patient down, though, if I didn't have their films or anything like that. It's still sometimes, you have to get in there, take your own pictures, and figure out sometimes the day of a plan. But I like to go into cases prepped and having at least a couple options ready to go off the bat. Things certainly change when you're there. That, your collaterals can change, even like what you saw in your diagnostics may not be there anymore when you actually get in there. But I think practicing and reviewing those angiograms is really important. And the more you do it, the more you'll see on them. I was always fascinated working with Bill, and he could just see things so quickly. And it used to make me so anxious because I was like, I can't see that. Like, how do you see those collaterals so quickly? Like, I just, but he would just be like, oh yeah, it's a diagonal that's coming to the OM, and then it's going to fix that post-bypass circ CTO. It's going to be straightforward. And it's like, well, how did you just put all that together in seconds? But it takes a long time and I'm still learning. But again, it's humbling. But yes, I think the more you prep yourself, the more you prepare, the better off you are when it actually comes to the case.
And then how about stress? Do you get stressed in those cases? Do they come natural and relaxed to you right now? How do you feel when you do some of those cases?
If you ask my staff, they will laugh at that. I think probably because I always say, one day I won't get nervous when I scrub it. one day it'll just be calm, and I'll be so calm, cool, and collected. But I do. I think I get nervous every time I'm doing procedures, whether it's going well or not, until it's like done. But I also enjoy doing them, so I enjoy talking through them. And I think if I wasn't nervous, I don't know, maybe it wouldn't turn out so well and whatnot, but I think that's just a part of it. And I'm always prepared or expecting the worst, so that when it goes well, it just feels that much better. But yeah, I still get stressed. I still get nervous. I don't know if that'll ever stop, though. Hopefully one day. I don't know. Do you get still nervous? I feel like you're very, very, very excellent at these sort of procedures and have been doing them for a long time. Do you feel like every time you scrub in though that you still get nervous or anxious about them, or have you calmed down?
No, I think I do. I do get nervous, and there's some case. Obviously, things start not going very well. The pressure is not perfect. I mean, obviously, you get super kind of alert for
Hmm.
that. But I think you have to be. It's a balance, right? If you're completely relaxed and you fall
Yeah.
asleep, if you're super nervous, things don't go well. So somewhere in the middle,
Yeah.
where you're, at least my feeling is, you have to be alert. You have to be a little nervous, a little anxious, but not too much because then things can come
Yes.
up. So
Yep. 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 I agree.
now, how about proctoring and live cases? How useful do you find those as learning tools? And do you think this is something that should be done more or less?
Yeah. So I think proctoring kind of comes back to the goal of the person that you're proctoring, depending on the skill set they want to learn. So you want to make sure that if you are proctoring or you're going to get proctored, that you're going somewhere that you're learning something new or something that you want to learn, and that proctor that you chose is actually capable of doing that and can walk you through it. I think we've all seen those teachers who can do it, but maybe not speak through it and educate you and about the steps that are kind of going on. Alternatively, there are people that'll talk you through something, but maybe have never actually done it, and it's just a matter of knowing kind of who does what and what kind of skills you want to learn. But I think proctoring is an excellent way for operators that can't do a dedicated year to training or don't have the opportunity to set aside a block of time to learn a technique, that they go and they find proctors that are doing it, maybe not the same proctor, maybe a few different ones, and actually learn a skill set. I think proctoring is very valuable. Live cases, I think, are phenomenal. I think they're really helpful if the operator is talking through what they're thinking, what their next step is going to be, what if that next step fails, what that process is going to look like for them. I think live cases, though, you can learn a tremendous amount from.
And then when it comes to the radiation and cath lab safety, people get stressed out to various extents. How is that bothering you, and what do you do for radiation safety?
No, and that was one of the biggest things I think going through my general cardiology fellowship, that I was told, don't go into interventional. You're a female. Don't expose yourself to radiation. You don't want to be wearing lead for the next 30 plus years. Like, well, it's amazing. I love Rampart. Any sort of, I think, protection device like this that you put up, you don't have to wear your lead. You have your Race Safe badge on. You're monitoring it. It's just a total change of the game. It's also a change for the staff involved, not having to worry about being exposed to all the scatter and the radiation coming from the procedure itself. So yeah, I think that's been it's life changing, and not to have to put lead on every time that you're doing longer procedures and those sorts has really helped. I was also using quite a bit of Corindus, so that helped a lot. And the combination of the two is certainly something that a lot of operators are doing also. But I think there's so much technology currently and undergoing development that down the road, I think it's a fear that we can really not have anymore, which I think is really a great thing for our careers.
Yeah, absolutely. And I guess some people are still a little concerned, even with the Rampart, whether you still get some radiation. But looks like you're comfortable and you're monitoring with the live dosimeter that you're doing okay.
Yeah, I think that's the important part. You really have to look for if there's any holes, make sure that if there is any gaps, that it's covered with some sort of rad pad. There's a bunch of systems out there also. It's just that's the one that we have at our institution. I think just being cognizant of that, the Race Safe badge certainly helps. I've worn one on top and below just to make sure that there's nothing that I'm missing from either angle, and I come out and it's like zero, and it's pretty phenomenal. And no back pain. So, yeah.
Perfect. And then when it comes to the demands of doing complex procedures with all the long hours, stress, etc. You mentioned you're a runner. What else do you do? How do you keep the balance, and how do you keep your being in good shape and motivated?
So, I really do think exercise is important, not only because I'm a cardiologist at the end of the day and I should advocate this because I do it and my patients should do it, but mentally, I think it's super helpful. The ability to get out there and get fresh air, whether it is on a treadmill or actually outside running, is super in helpful for a reset of us mentally, but it kicks in those endorphins and just makes us feel better. And it doesn't have to be something that you go out and you run. You have to run 10 miles each time, but doing a couple miles, doing a 30-minute run on the weekends, if you have more time, you're not on call, maybe doing something a little bit longer, whatever it is that you enjoy, if it's cycling or running, rowing, whatever it is, I think doing something physical is super important. I try to exercise 3 to 5 times minimum a week. If I'm fortunate that I can go ride my horses or compete, I'll also squeeze that in on a non-call weekend. So I will keep all this kind of going. I love being outdoors. I'm a very much an outdoors person. So the only thing that keeps me from being outdoors is when there's a lot of snow and sleet. I don't like the cold. But yeah.
Well, riding horses, that must be stressful in itself.
It's a different kind of stress, but it's a fun stress. I don't know. Yeah. Oh, I love it. It's great. It's been a passion of mine since I was like 2 or 3. So yeah.
No, amazing. I think you're at least so far, the only person I know that has this as a hobby. So that's congratulations. This sounds amazing.
Yeah, it's fun.
And now, do you have any favorite book or movies?
So, what am I reading right now? I think it's called like Everybody Needs a Little Help. I read a lot of self-help books. I think I found those to be very insightful. Sometimes they're not super relevant in certain areas of the book, but a lot of them, encourage you to look inside and figure out, where the problem is, as well as like maybe, if talking to somebody is better. And motivational things. I enjoy, that's what I enjoy. Once in a while, I'll sit down and read something fictional and whatnot, but anything self-help, motivational, those sorts of books I enjoy. Oh man, movie. Oh, I don't know. I haven't watched any good movies in a long time. I'm one of those that will watch like a 30-minute show and then I go back to reading or doing something else. But yeah, I like comedies, probably something light and airy. I don't like horror. Nope, nope, nope.
Perfect. I guess you have enough stress in the cath lab. You don't need any more
Yeah.
to be added on that.
Yeah.
So, Rhian, what are you? I know you've done many things, obviously, professionally, personally. What are you most proud of that you've done so far?
I think it's as simple as doing what I'm doing now. Along the way, I've had amazing mentors, but I've also had quite a few docs tell me or try to push me away from doing what I'm doing. And I'm thrilled to be able to do the complex disease and do these sorts of cases day in and day out. Like, it truly excites me. I really love what I do. I think every day I go to work is fun. And I feel like if you don't enjoy what you do, it's going to be a long career for anybody. So I'm passionate about what I do, and I'm happy that I got to this point and that I didn't listen to a lot of the people that try to talk me out of it. And I'm fortunate for mentors like Dr. Gilchrist and Dr. Abbott and Dr. Lombardi, because without all of them, I don't know where I would be right at this point. But yeah, so simple as that.
Yeah, so clearly the teacher is important, as you say, and having a mentor that you can learn from and bounce ideas from, even at any stage, that's critically important. What is your vision for the future? What are you most excited about for the things coming up?
I think, I want to encourage more people to do complex coronary disease. I don't think we're going to have a lot more of these type A lesions coming into our labs. Everybody is getting older. people are eating terribly, people are not exercising. So the complexity of the disease is only going to get worse as time goes on. And I think training people and teaching people and getting them excited about doing these cases and not looking at them as they're long and tortuous for the operator to do, and getting them excited about it, I think is something, to look forward to, and being a voice for patients that need our help, and teaching the future operators is key.
Perfect. And then what's your advice for women? I know that, there's more and more coming. This used to be very few people, but now, fortunately, yourself, other people are joining the group, and it's becoming much more, which is wonderful. What would your advice to other women who are now training in intervention and potentially considering the complex PCI, since you have obviously a firsthand knowledge of the topic?
I think, if it's something that you want to do and it's something that drives you, learn it, do it. Don't listen to people who say not to do it, and learn from those who are currently doing it. Reach out. I'm always happy to talk to people. I'm always happy to coordinate. If you want to come to my lab and learn, or if you want to go somewhere that I'm friends with the person, I'll text them. I'll get them on the phone to see if maybe they can mentor them, depending on where the person lives. But yeah, I think it's a really exciting time for women. I think the possibilities are endless. It just depends on what you want to do within the field. Actually, next week, I'm doing a Women in Cardiology CTO program at my institution, where we're having about 15 female operators from all over the world come and learn at bedside. We're going to have a couple live cases, and we're going to do a teaching night the day before and throughout the course. And then it'll be on Zoom, so anybody can watch. But we really wanted to focus on encouraging females who are trying to develop these programs at their institutions to have resources that they can reach out to us, or if I've had the difficulty doing something, that I can give them kind of tips, or other people there can give tips, and go from there. Yeah. So I'm very excited. And I think if you're a female and you're thinking about this, just do it. You're going to be great.
Yeah, congratulations. I think that's part of this, also having the role models, yourself serving as a role model as well. That goes a long way to people to visualize that, this is something that, it's possible, if, of course, that's what they want to do down the line. Now, and also, I know you also done, several research, some very good publications. I really loved your case on the fenestrating the papyrus and getting through. So very, very creative and very good in writing. How has that been helping your clinical work or your approach to CTO-PCI?
I think writing is super helpful. When you put pen to paper, you learn a lot. You also learn a lot because you end up reaching out or researching to see if something's been done similar to it elsewhere, and figuring out what else is being done out there that maybe you weren't aware of, or the techniques that are being developed, or, devices in different spaces that are under research, or trying to see if it can help shorten or increase success rates for CTO-PCI. So research, I think it just goes hand in hand with growth of the field. The more we do and the more we're involved in, the better off we're going to be. So the more you're reading, the more you know what's going on out there, the more helpful it is. And I think it just sparks creativity. So, an idea can go a long way, particularly if you do it in a group fashion, and you're reaching out to other people that are maybe beating the same obstacles to try to come up with a way to overcome those.
Wonderful. So, again, congratulations for everything you've done. If you had to give a final piece of advice for people watching, what would be the key pieces for those who want to become like yourself, experts in doing complex and CTO-PCI?
I think ultimately, if it's something you want to do, find the people that you want to learn from, reach out to them, learn it, and do it. If you're passionate about something, don't be afraid that you don't have that skill set, or that you're not as dexterity is not as good with wires. These are things that you'll come to, you'll figure it out, you'll learn it. Being patient with yourself is key, though.
Wonderful. Rhian, thanks again so much. That was amazing learning your journey to becoming such an accomplished operator. Super excited to keep on working with you. And thanks again so
Thank you
much.
so much. I love the opportunity to have done this. Thank you.
Thank you for listening to the Sensei podcast.